Jeri, would you like to introduce yourself?
Yes,
Great.
it's so nice to see you all. I hope that we'll have an interesting chat here today. I am a core faculty member at Capella University, and I teach counselor education and supervision. So if you all will bear with me, I will kind of go that way. In terms of my own perception and the perspective from which I work. But I have an interesting variety of experience. I have a good bit of pastoral training, which occurred before I went back and got my master's and doctorate in counseling. But I've worked in Research One University, I've worked in an HBCU, and now I'm with Capella, and I really love, I do online teaching, always have, so it's not new for us, but it's really wonderful. And we do have some live experiences, although nobody's having much other than virtual anything these days, but we know how to do it. So Zoom is a friend. And we're just happy to be able to do this and have folks from all over. So again, my background is psychology and mental health counseling, although I also studied school counseling because I didn't know where I'd get a job. And my first teaching job was actually school counseling. But now I'm primarily with the doctoral program at Capella with the PhD in counselor education and supervision. So that's kind of where I come from. I have a variety of family members from some blended units and new grandbabies with whom I'm having a blast. So a lot of transitions in our lives. And I'll tell you, this topic occurred to me for several reasons. And first of all, we have to have ethics all the time, right? So it's in every course we teach. It's even in our fieldwork courses, we're talking about ethics, and it's just such an important topic. But I'm going to have a PowerPoint that I will use just as a guide. Okay, it sort of helps me organize, but it'll also give you some ideas to help connect a bit of what I'm talking about, and maybe even help you all with questions. So please feel free to, jump in, wave at me or something so I know to hush, because I used to talking and I can just talk for a whole hour. I feel like I'm pretty well versed in choice theory, reality therapy. So Bob Webelding and John Burkell were my trainers. Cynthia Mason, I see Cynthia, and Gloria Cisse and I were part of the Glasser Scholars Program that Dr. Glasser offered, and had an absolutely fabulous time. We were able to meet him, Dr. Glasser, twice, and it really made this even more of a personal connection, I think, for us in our training. But I think many people who really embrace choice theory understand that it becomes a part of how you think about living. And I think that some of that will come through in what I share with you all today. So I was certified in Edinburgh, Scotland, which was the most fabulous experience at the conference there, and got to meet folks from all over the world. So enough about me. Let's talk about ethics and choice. So again, I do want to encourage you all to, ask questions. So I'm going to share with you all. Let's see here. I can't see too. Oh, I want to show the slides. Hang on. Show the slides as slides. Okay, there we go. All right. this is kind of how we're going to start. This is what we're going to do for today, okay? We're going to just briefly, it looks like the folks who are here may be pretty darn familiar with choice theory reality therapy. Whoops, what's this? Okay, I'm going backwards. Sorry. This is me, okay? Please move this window away. Janet, can you help me? I don't know what this means.
I have no idea what that is.
Well, that's not very pretty. Okay, well, all right, there it goes. Also want to just sort of talk about ethics in general. This is not going to be your ethics training course, okay? So I hope that you will have some idea of seeing ethics in a different way, really focused on the concepts of choice theory, reality therapy. So I'll talk a little bit more about that. And then finally, I think that as we try to make sense and make meaning out of this, talking about the process of choice and then options for choice. So I didn't use a lot of graphics and art, but this is Lake Geneva. And this was one of my first international conferences. And I don't know, it came up on my computer and I thought it was a good idea. Just the point being that choice theory is all over the world. And it is so wonderful to know that, you know, we can talk to people from South Africa, Israel, South Korea, what do we have? Kuwait, I mean, all over the world, Croatia, as well as certainly United States and Canada are really strong. So I particularly love to travel, and so that was just a connection I had made. So I was going to try to do a poll here, but I'm curious, when I say who is with us today, how many people are students? You can just wave. Do we have any students here? Allie, I know Becky and Wes. Okay. Educators. How many educators are here? Dave, Wes, yeah, Cynthia. I know Gloria is. Mike, I think is. All right. And so I think, is there anybody outside of academia? That might be Jocelyn. Okay, thank you. And Wes. Okay. Because I don't want to just, you know, talk out of context that's not going to be meaningful for you. So I want to, you know, make sure that I touch on what you need. So please let me know. Needs. Got it? Remember the whole needs thing, right? All right. So these are going to be important points to consider as I'm talking about this concept of ethics and what we need to do there. Choice theory, in terms of William Glasser's idea, as you remember in training, if you've gone through the certification process, he wanted to understand how behavior is understood through the brain. And so we do that fabulous brain chart, and we try to make sense out of, you know, the input from the external world and what's going on inside. And what I loved about it, I think, is the fact that it's so holistic. It's not just about what we're thinking, because if you look down the list here, we talk about total behavior. You're not thinking without having a feeling attached, even a physiological response, though those are a bit less out of your awareness, but your actions are directly related. It's a combination of all that, hence total behavior. And as we know, most people use the word behavior as the acting part. If you hear a teacher talk about a child's behavior in the classroom, they're talking about what they're seeing. So that's typically the acting part. if we were to be a counselor, school counselor, mental health counselor, even a parent, and there's a whole book and bit of research on parenting with choice theory. Glasser addressed it in books that he wrote. But the idea that if we can understand what we see in connection to the thoughts that are going on, the feelings that are attached, and quite often that physiological response is visible, but not always. And so understanding all those components helps us to make meaning out of it. And as professionals, or even as a parent, it helps to guide us towards helpful interventions, helpful actions that we can take to improve or change behavior that's ineffective, right? So Bob Wobelding is in my head. He was just such a great influence and so down to earth in how he taught us. But I love to watch how just, practical he is. And it's as simple as, is this helping you or is this hurting you? And so a young child may not get that, but we get it. And so again, it's one of those elements that's very tied to what I understand anyway about this theory that can really help us to improve our own behavior, or in my profession, it's either counseling a client or helping my learners to understand better, do better, so on and so forth. So the key to the theory is this idea of these 5 psychological needs. And I think this is going to be a big point in what I bring out today as we talk about ethics and how that relates. So love and belonging, or just belonging, however, it's been written both ways, is such a strong need for, I think, humans generally. Belonging to a family, belonging to a relationship, even one in our lives, is critical really to good health, especially physical health and mental health. But I also, for my own work, I have tied in spirituality in this area about belonging to something bigger than ourselves. And spirituality is, when I studied, I'm going to age myself here. When I studied psychology in the 70s, mid 70s, God and work, psychology were separate. If they want to talk about spirituality, you send them to their church or their priest, and you're like, and that's why I stepped away from psychology. It's like, I can't just do intraperson. How do we talk about healing for me without some spiritual element, whether it's God or whatever, faith or, nature, for heaven's sakes, but something bigger than us. All right. So freedom is another one. Even I think in Bob's book about self-evaluation, he talked about even Frankl, when he was in the Nazi internment, still held on to his freedom to think. That there is still that urge, that press that we have within us to not be absolutely, held to somebody else's rule, or what Glasser would have named external control. Fun, when I talk to my students, fun to me also is one of those areas where that's where we learn, right? Play is how children learn. And when we embrace fun as a part of our lives, something that's important, it allows us to open ourselves to creativity, which is very life enhancing. So again, a very strong need that a lot of people just, other theories don't talk about. Power is a loaded word. That's how I explain it when I'm trying to tell people about my theory. you know, it's always given such a negative connotation, and yet there are important elements of having inner control. Here we go back to the control. And remember, choice theory once was control theory, but power also is achievement. Now, I don't know about you, but I loved having my degrees. I was very proud of what I had accomplished. And so that would give me a developing competence, a developing sense of inner control, because it helps you to gain more perspective, but also stronger perspective. And then survival underlies, I mean, that's a basic human need, though, even if we're not talking about it. Sometimes the way I have explained that is, if I have a client who's been physically abused and they're coming in to talk about anything else, until that sense of safety or survival is managed for that client or that student, work anywhere else is not going to be significant, may not be effective. So quite often we have to make sure that safety, for one, is taken care of, and I tend to put that under that survival. All right, I touched briefly there on total behavior. Again, we call it the suitcase. So acting, thinking, feeling, emotion, affective, and physiology. So if I see a 14-year-old come in, slam the door, throw the book bag, I see those actions happening. They're pretty negative, okay? Not really a positive, statement being made there. I would wonder what they're thinking. I could imagine the feelings. I'm going to guess anger, perhaps frustration, it's hard to say, hurt. So, and then the physiology might be that reaction to throw, to hit. There could be tension in the shoulders there. We use anger a lot because it's something I think all of us have had an experience of, and we know that it does actually live in the body. So, that's something I actually use as a technique in counseling, is to help people break down, take a snapshot of time, what are all these parts, and have them go through and analyze, self-evaluate what's going on and break it down. And then sometimes, most times, you find a place where something can be different, hence a different outcome. That's what we hope. All right, and then quality world is certainly a big element here, and that is, our ideals. Everybody has their image of a good relationship, their image of a good marriage, their image of a good grade at the end of a course, their image of, profit at the end of the year, having good reviews on the internet about your counseling service or teaching or whatever. I don't ever go rate your prof, because it scares me a little. But anyway, so that quality world is important. When something that we're seeing happening or even doing in our lives doesn't match that quality world, those ideals, then there's, dysfunction and discord and a lack of congruence. And so we find that, what do we have? I mean, what happens if something doesn't match your quality world? What do you know? What do you do? What do you feel? What are you thinking? You all can answer.
My new good word is I get wonky.
Wonky. I love it. I love it. Anybody else?
Looking for what's worked in the past.
Oh, Mike, that's a good one.
Mhm.
You know, it's when you find that something's incongruent, then, you know, again, it's the same thing. It's not matching. So it's not matching the
Mhm.
quality world, the pictures that you carry, Glasser's, you know, metaphor of a photo album,
Mhm.
but, you know, going to a solution and, oh gosh, how can this be different? You might very well do that. Okay, well, has this ever happened before? What worked before? And let me try that, right? So to kind of wrap up, you all obviously know something about choice theory and reality therapy, but again, choice theory is the basis and foundation, but reality therapy is the clinical application, and that is credentialed professionals. So it's important for us to remember that distinction. You can't be a reality therapist without therapy credentials. Okay. All right, so let's talk a little bit about ethics. We all know so much about ethics. Oh my goodness. It's something that we do talk a lot about in academics, okay? But I found a book that's actually from the education department, and it fascinated me because it's actually called Real World Ethics. And it really got me thinking about multiple things. And I know I only have an hour here, but no matter what, when we start talking about ethics, whether it's just every day, if it's, you know, the gardener, if it's the garbage man, if it's the teacher, if it's the nurse, you know, most people recognize this primum non nocere, which is first do no harm, right? It's part of the Hippocratic Oath, but you also know that for me, my own set of ethical code standards is for counseling, and it's clearly right there. Do no harm. So you don't have to be a professional with a degree to recognize that doing good is something that I think, I do believe in the Carl Rogers Foundation that most people are good. And I keep that positive psychology sort of mentality around me because I don't want to believe otherwise. Even though we've seen some, you know, destruction and chaos, I think ultimately people want to be good. But it's so important to realize that doing good is also recognizing that there's harm, right? So the potential for harm is a basis for us to say, oh, but I want to do good. And so whatever steps we can take in our lives to reduce harm in any way can help us minimize the potential for that to occur from our behavior, right? Whatever we're doing, thinking, saying, would be acting, the feelings that we have some control there. And that idea of having personal control is wrapped up in empowerment. So when we see a lot of communication coming out around social justice, you know, empowerment is a very strong word that's helpful for us to consider that people who see themselves as victims and ride the victim mentality, even if it's unconscious, I don't know that most people really want to see themselves that way, but they're recognizing that they have no power. That's in their mind. But we all have choices, right? We all have choices. And so when we're talking about ethics, and whether it's how we live our daily life as a neighbor to perhaps a professional stance where, you know, I'm teaching in a university new professionals who could go out and do great damage. I have a very strong responsibility as a gatekeeper to the profession of counseling and education, because as I'm working with doctoral students, they're your future educators. So I take that very seriously, but I also consider that the ethics of daily living about not doing harm and embracing the fact that I want to do good is a choice. Okay. And so when I'm thinking about choice and choosing and a good bit of reading in ethics, two concepts come up a lot. That is intention and motivation. So we can have a lot of well-intentioned folks who do bad things. Okay. So intention is not enough. Whether it's a layperson or a professional skill, when we're thinking about being helpers or doing good, what occurred to me is power. There's an abuse of power as a potential pitfall ethically in how we're choosing what we do or what we don't do. And so the more I played with these ideas in my own head, choice theory came forward for me. Similarly, motivation. Just because I'm motivated to make things better, that would be an understanding for people who want to be helpers. And so my profession of counseling is to be a helper. My profession as an educator is to be a helper. And I made those choices very specifically because I want to make things better. So I drive all of my students quite crazy with writing reviews, two of whom are here with us today, and I'm not going to ask them to speak to it, but they could, and it's fine if you want to speak to that. But I do want them to make their dissertations better. And I think that ultimately, even though it's a pain to revise, it does help. And, you know, so that's something that I think I do well. I tend to share that. Okay, so let's see, what do we have here? Do we have, oh, we have chat going. One of my students, yes, Wes. All right. But, you know, when we're thinking about what motivates us, so say, for instance, I'm doing what we call residencies at Capella. So yes, we're an online university, but as we're training our mental health, school counselors, marriage and family therapists, clinical psychology students, we have these face-to-face gatherings. So for, say, 5-6 days, we come together, faculty, and then small groups of students, and we learn intensely, you know, like 8 to 5 every day on skills. And we infuse discussion of ethics and various theoretical concepts. So I've been trying to teach theory, and I'm often very pleased that students have not been exposed very well to reality therapy. And I can get some of them to jump on board, which is always exciting. But, you know, being able to communicate to students what reality therapy is about, what choice theory means as a way of living, okay, I can ask questions like, I'll start off often with, why do you want to be a counselor? And what do you expect is one of the first things they say? So why do you want to be a counselor?
Help others.
Help others. Often one of the first ones. Why do you do what you want to do? Right? Why do you, did I say that backwards? Why do you want to do what you do? help others. What else?
Make a positive impact.
Okay. And you know what? I know that for myself, and I challenge everybody who studied psychology, I would also say I was working on myself. I want to understand my own behavior, and I want to understand the behavior of others better. And so, you know, in doing that in an academic environment, you know, sort of, right, puts a little stamp of approval or something. But in the end, I am quite a nerd, and I love the fact that I really look to make meaning of things and pull it in and make sense out of it. So when we talk about motivation to be ethically good in our lives or in our profession, there's just something about associating with people who are relatively helpless and defenseless that forms at least part of a motivation to help. When you see that, what occurs to you? What kind of impact does that statement make? I was a bit challenged when I read that. Any thoughts?
Have the risk to feed into your own ego and influencing and other people.
Yep. I think that's probably where I went too, Becky, was, whoa, what do you mean? I'm pure, I want to help, da, da, da. But what does that do? That takes us back to that possibility of a need for power. Okay, so that's power in the sense of perhaps external control, but it's very real in the potential for abuse and misuse of our good intentions, right? All right, so I did want to touch on some ideas around using ethics. And of course, I think that most of us, many of us, recognize that it's good to have things written down. All right, so people in various professions, you know, at some point sit down and say, okay, so what do we agree are standards? What do we agree are, you know, points that we want to ensure every teacher, every counselor, every nurse and doctor? So we create codes, right? And so ethical codes are to guide our behavior and keep us pure, right? So the three big areas of choice theory are certainly around counseling and helping, social work, psychology, marriage and family therapy. Then there is quality schools. And so quality schools is an actual process of certification that schools can enter and pursue and demonstrate their use of the concepts of choice theory. And it's a very collaborative, very relationship-oriented way of being. And everybody needs to buy in. So having studied school counseling, you know, the principal guides what happens in the setting. So you have to make sure that you get the buy-in from administration, but also staff, okay? The lunch ladies, the janitors, the, you know, IT people, whatever, everybody buys in. It's simple, but it is a whole area of choice theory, and we're looking to see some newer research in that area. Then, so I just chose the American School Counselor Association has a wonderful code of ethics, okay? Then, as I was looking up business ethics, okay, this would validate, affirm, you know, guide, enhance, lead management, which is another area where choice theory has a significant statement of being, of how to behave in industry and in business. So I did some research looking, is there such a thing as a main business code of ethics? Well, no. There are all kinds of codes of ethics all over, but I found something called the Davos Manifesto, which came out of the World Forum, and very, very interesting document to read. And I think that you would find, if you did so, you would find that there's a lot of choice theory terminology in there. So I'm going to show you a few examples. So if I'm looking at ethics for counselors, I jumped all the way down here to do no harm, right? That's a big one. But I want you to look at some of the wording here. I highlighted autonomy or fostering the right to control the direction of one's life. That is choice theory. It's like, it's there, it's in our ethics specifically, okay? So not only did Glasser, from a medical psychiatry background, already, have a sense of ethics, do no harm, Hippocratic oath from his training, but so much of the conceptualization around how we do good, how we are helpers, is influencing how we're going to behave in our profession. So when we understand that these ethical principles are specifically laid out in the terminology, these are fundamental principles of professional ethical behavior. Autonomy, all right? So for our clients, our students, our neighbors, do they have autonomy? Do they have the right to control? They have the right. Do they have the personal power to do so? They may not see it. They may not think it. They may not believe it, but there's an area for improvement in their life. Look at working for the good of the individual and society by promoting mental health and well-being. Oh my gosh. I mean, is that not just perfect? That is exactly what it is to be a helper. Working for the good of the individual and society, I think, is so important, that as we embrace an ethical way of being in the world, whether it's professionally or personally, that it comes back to, what is it to do good? What is it to live in a way that we do no harm, right? Treating individuals equitably and fostering fairness and equality. Those things just, I mean, you can go through the ethical code and start pulling stuff out. I mean, it's just like, I can't go on and on and on. Y'all would just be bored to tears. But the idea is, Glasser talked so much about relationship and the critical importance of relationships. So if we look at psychological problems, he said, yeah, when you get down to it, relationship somewhere is the issue. Okay. So we recognize that. And so this is not just relationship in my mind. So you can share with me, but in my mind, it's not just relationship with one other person, but it's to my world, to myself. I think those are critical parts of relationship. Any thoughts before I go on? Is this interesting? A little bit? Okay. All right. All right. So now that was reality therapy, counseling, professional helping. Okay. So now here we are for school counselors. Okay. Connecting school programs to the mission and improvement plans. Now, how does that fit with choice theory? Relationship? Yes. Power? Inner control, competence, maybe something about achievement. Certainly, having studied some school counseling, Those are important concepts to take into the school setting when you're working with your students. And so many students come from unhealthy backgrounds that as the counselor, if we can make a difference in that setting to help them have a stronger sense of themselves, ultimately, it goes to the family. Ultimately, it goes out into the district. Ultimately, if we can build on that district mission, then the school counselor can have a great deal of influence and build on relationships, build on the important elements of student work, including achievement, work on making sure that children still have a place for fun, because we know that's where they learn. Taking all of the fine arts out of the education system is not the answer, okay? We need them to learn an instrument and have fun. That may be where they excel, right? All right, going further down here, move towards self-determination, self-fulfillment. Oh, there we go. So the words are right there, because what do we know about choice theory? Choice theory embraces self-evaluation as a key part of using the theory, but its focus is on that personal responsibility. I personally love to work with teenagers. Okay, it was so funny that even when I was in bachelor college, I did work on an inpatient unit, and they always assigned me the teenagers, probably because I was young, but I learned from that time forward that I embrace the whole package of child adult, right? They think they want to be adults and make all these big decisions, but they're still babies and they still need so much wisdom of the world. But I find that very interesting. But this is such a great way. Choice theory absolutely helps teach personal responsibility, accountability, and I think it's the best tool to use working in schools, working with families. I mean, certainly a lot of adults might be 30, but you know, they're 8 emotionally, so right, we all still carry some of that stuff. But finishing up this particular part here with schools, quality school means that we're looking at students' academic, career, social, emotional needs, and looking for maximum development. Is that not choice theory? That's all choice theory. Absolutely. So as I'm thinking about educating, because that's, again, the context of my major work, I'm talking to students about how does your theoretical orientation inform what you do? Well, my theoretical orientation of choice theory, reality therapy absolutely guides me. And what I find is it's all through our ethics, through our codes, and through the way that we think about helping. All right, now this is for business. So again, lead management is a growing, very interesting part of using choice theory in business settings, which for any of you certified opens up a real opportunity for consultation. Really interesting way to take what you know and really help people make better work experiences. So this Davos Manifesto was very interesting. Again, it came out of what's called a World Forum. And oh gosh, I started reading, and look at here, satisfy the client's needs. It's like, oh, choice theory, there it is. Of course, that's what we want. Gives them the best values. So now we're talking about value ethics. Oh my, if you have not really thought to dive into ethics, I had so much fun. I like research, but there is care ethics that I saved articles about because I'm just absolutely fascinated with. It was in nursing and social work literature, fabulous. I did a 5-year stint as an on-call chaplain, the Children's Hospital in Cincinnati, Ohio. And I learned a great deal about bioethics. So there are ethics working in all of our professions, but it just tells you how we can take ethics and break it and make it relevant. It is so interesting. But to have our choice theory words woven through these codes was just amazing. Leadership must integrate the interests of those who are led. So that goes back to relationship. It goes back to understanding needs and helping people get their needs satisfied. It's fabulous. Now, the last one I highlighted there about assuming the role of a trustee, to me came out of, as I was, entrenched in choice theory and reality therapy, as I'm thinking, and ethics and imagining what I do and what I know from, the medical setting to an educational setting to a client counseling office. That responsibility of gatekeeping is a role of trustee in my education work. That role of trustee is my parenting role with my children and my grandchildren. And it goes back again to the idea of relationship and belonging and the value that, from my understanding, would be the value I place on that. So one of the best things I learned from that chaplain experience was not only how supervision can be amazingly important, because as an on-call chaplain, I worked in the ER, the intensive care unit. I don't know what you know about the Cincinnati Children's Hospital, but it has world-renowned work, from the neonatal unit to oncology to transplants. So all critical care was my responsibility, either overnight or on weekends. So I was the chaplain. So I had to learn how to use crackers and grape juice for rituals and, help people from other faiths find what they needed. Certainly couldn't lead, specific ceremonies, but I was there to, I hate to say validate, but sort of be a presence of calm and prayer and sharing that experience, certainly. But the question that I will never forget and always use is whose needs are being met. And that goes back, Becky, I'm gonna speak to that. That goes back to that. Am I doing this because it's my benefit, or am I doing this because it's for the benefit of the client? So from an ethical standpoint, I need to make sure that it's not enough to have good intentions. Good motivations can actually be very selfish, right? People who want to be helpers can get sort of a power trip on, I did it, and it's not really about the benefit to who's being helped. So, anything can be morphed into a negative, right? But when we keep in mind how it is that we want to do good, how we want to be ethical in our lives, and take with us choice theory, it comes back to, and I hadn't read choice theory until after I got my doctorate. So this stint as a chaplain was well before that. And look at the question I learned that I use. Whose needs are being met? Oh, it was like choice theory. Oh my God, I love it. So these are some of the choices and ways of choosing. So it kind of, ties into that last part of the presentation. I love Bob's question. Is it helpful or unhelpful, right? Is it helping you or is it hurting you? We have to discern what feels right, but feeling isn't enough. We do have to think through it and rationalize. We do have to know something about the client, the person who's injured. We have to know something about what harm is possible so we avoid it, right? But we do know that the external world influences, but ultimately we have choice. So if we can do anything in this world, it's to help people recognize that they have choice. They're not totally given over to the system, not even in communism. Look how many people, my mate came from Romania and escaped communist Romania. And even though he knew how to join the Communist Party because it mattered to his job, everything he did, he set up for years in order to escape. I mean, he still embraced freedom, but he knew what he had to do from an outward appearance. And all the talk about what manipulation happens, good people tell on their neighbors because they're afraid. We don't want to live in a world of fear. So, you know, what's going on in the external world does influence us, but ultimately we can still choose. We can choose how we think. And, you know, there are techniques for thought stopping. Takes practice, right? We have less influence over how we feel, like, oh, I'm not going to feel angry. Well, you know, you can work on that. Mindfulness is a good thing. But, you know, when we have some understanding of something like choice theory, that's very practical. It's so practical, so in the here and now. We can use it to not only diagnose a situation, maybe I should say assess, but also how to intervene, okay? Going back to the 5 psychological needs, you all can look at that, but what I want to make the point is, because I am aware of time and I want you all to speak to me. Satisfaction for the needs is current state. So we need to remember that even as we are feeling a need to help, that urge to do something, that's current state. And choice theory is not interested in an extensive history, because ultimately we can't change that, right? But we can make a difference on what's dysfunction now and what happens from here on out, okay? So I recommend, here's our quality world. That's mine. There are some fun things there, right? Look at the Ferris wheel and boats. There's a boat for you, Dave, and cruise liner, anybody who likes cruises. Anyway, so there's our quality world, but please consult, get supervision, find your resources. So that's kind of where I am at this point, and we have a little bit of time. I'd love to hear your thoughts on how you might have seen me connect choice theory, reality therapy with ethics. The floor is yours.
One thing that comes to my mind when discussing ethics, as you were presenting, how does your theoretical orientation guide you in your ethics? One scenario I can think of where you could see a clinician go in a lot of different directions based on their theoretical orientation is when a client, it may be from time to time, in our program we have clients ranging from children, youth, adults, a lot of adults with intellectual disabilities. From time to time, they may ask a question such as, "Are you my friend?" And the clinicians, just from having ethical conversations with other clinicians, their theoretical orientation really oftentimes helps dictate how they're going to handle that response. Someone who comes from a behavioral background where the belief is to be objective is going to handle that much differently than someone who comes from a person-centered background or choice theory, reality therapy background. So that always ends up to some really interesting ethical discussion because of just how different those kind of situations can be handled.
Thanks, Mike. I feel very strongly about it, and you know, I try to talk to learners about it, and it doesn't make sense to everyone at a very early developmental stage. And I think developmentalism is really critical when we're trying to understand, you know, what I might share with you all who do have some choice theory, reality therapy experience, some of you with more than me, to someone who's just learning about it. You know, we can have different conversations, but I think in the end, just some of the basic concepts of choice theory absolutely inform the way I live as an ethical person, you know.
It's been helpful to me to be able to figure out how can I maintain my ethical boundaries, but yet same time maintain connected to the client.
I love boundaries. Boy, that could be a whole, there you go, Mike. There's your research symposium presentation. Do boundaries. That's a whole hour there. Love it.
Dr. Ellis?
Yeah.
Yeah, I was, I had the same type of challenge just in the last couple of weeks. Been working with a teenager for about a year, actually a little bit longer than a year. And he called me up and wanted me to go out to dinner with his family. And so looking at the ethical boundaries there and wanting to maintain that connection with my client and to try, and especially working with a teenager, it's awful hard sometimes to let them know what a professional boundary would be. I had to approach it in such a way where I'm still reaching out to his need of connection with his counselor at the same time while maintaining that professional boundary. Depending on how I approach it, I could push him away or I could keep him engaged.
Yeah, that's a challenge. Anybody else? Any thoughts about?
I have something. You know, what I find, and I guess it's because I move a lot. I have moved a lot, but I find that ethics, like, you know, for each state for counselors are different. And I'm sure ethics in different countries for, you know, professions will be different as well. And I think that's why I focus on choice theory as internal. It's my internal ethical system, because then I can use that better than all the other things, you know, the I don't know if you say restrictions or guidelines or whatever you want to call them, because we must have a universal ethical place, you know, belief system. It has to be universal, because then we would really step on toes. Like you said, Wesley, you know, there's their place where you're not sure, and Mike too, where you know you have to be really careful, but yet then how do we keep within all those different boundaries and restrictions and ideas? It's really complicated.
Also, the procedures that lead to change, the whether you call it the WDP or whatever system or procedures that you call it, can be quite helpful in the decision making and that ethical decision making. You can look at like Corey's guidelines for ethical decision making, see right where you incorporate those reality therapy questions, just tweaking them to a different arena. Instead of asking what do you want, well, what are the ethical codes? And what are the ethical codes that maybe are in conflict with one another? And so you can still use the same questions in ethical decision making just as you do with helping your clients.
That's true. It's very true. 1 minute.
We have 1 minute, and I'd like to make a plug. February 13th, What It Takes to Be Evidence-Based is next, by Dr. Bob Wilding. And Jeri, this was really thought-provoking. So I appreciate this, and really paralleled very well with choice theory. So thank you. Anybody else have a question before we go?
You're welcome. I appreciate all of you coming. Excellent.
Thank you, everyone. I'll see you next month, February 13th. Happy New Year. Bye.
Thank you.
Bye.